Now to the coronavirus pandemic. The Delta variant is exploding across the U.S. During a Senate hearing Tuesday, the head of the CDC warned areas with low vaccine coverage are, quote, allowing for the rapid spread of this more contagious strain. Dr. Rochelle Walensky says average daily deaths have almost doubled in 1 week. Manuel Bojorquez is in Miami with more.
Tonight, Florida is preparing for the worst as cases of the Delta variant surge. And while nowhere near the pandemic highs, a fourth, mostly preventable wave is appearing.
It's frustrating. It's past beyond sadness.
A 111% jump in COVID patients over the last 2 weeks at Miami's Jackson Health System means most hospital visitors will be banned. 95% of patients with the virus being treated here are unvaccinated.
The amount of disease process that they go through is incredible. It's terrible. It's absolutely terrible.
Nurse manager Alex Saharsky says the patients are coming in younger, and with the Delta variant, they're getting sicker faster.
A very young patient, in her 20s, she has asthma, little history of asthma, did not get vaccinated, and she ended up passing away.
She died.
Only lasted maybe 12 days.
It's not just South Florida. The state as a whole accounts for nearly 20% of the nation's new cases over the last week. Nationwide, while vaccination rates have plunged since the middle of April, the more contagious Delta variant has gained a foothold, rising exponentially. Today on Capitol Hill, the CDC director put it bluntly.
The Delta variant now represents 83% of sequenced cases.
In that same hearing, an exchange between Senator Rand Paul and Dr. Anthony Fauci over the virus's origins went like this.
Because you're trying to obscure responsibility for 4 million people dying around the world from a pandemic.
I totally resent the lie that you are now propagating. And if anybody is lying here, Senator, it is you.
Still, the biggest battle against COVID remains on the front lines.
I know that you hope these numbers will start to go down.
I do.
But do you think they will?
I truly, honestly, I know in my heart they won't.
Tonight, a new lab study found that Johnson & Johnson vaccine elicits lower levels of protective antibodies against the Delta variant as compared to the Pfizer or Moderna vaccines. But it's unclear whether the shot still provides enough protection in people or whether a booster shot may be needed. Elaine?
Manuel Bojorquez, thank you. Dr. Jessica Shepard joins me now. She's the Chief Medical Officer at Verywell Health. Doctor, thank you for being with us. The CDC says the Delta variant now accounts for 83% of U.S. cases. It was at 50% less than 3 weeks ago. What does this tell us about the potential damage this variant can cause in the U.S.?
We have seen that this fourth wave is pretty significant when we look at that number. Hearing from the CDC that it's increased by 70% of these admissions to the hospital, where we've seen ICU units throughout the country close previously and now having to reopen. We know that this Delta variant is spreading among non-vaccinated people, and it's becoming dominantly very quickly throughout the country.
Well, daily coronavirus vaccinations in the U.S. are hovering at around 400,000. That's far below the April peak, despite pleas from the Biden administration and health officials. How can officials best fight vaccine resistance? Could a mandate be in our future?
We have seen that in some of our education systems where teachers are required to get the vaccine. We may see shortly here over the next few weeks when other work areas, we know that hospitals have a very stringent protocol on making sure that their employees get the vaccination. But what we're seeing again is that unvaccinated people are really the cause of having this transmission of the Delta variant. And again, having more cases and also infections and admissions to the ICU. It is very likely that we will see some institutions making sure that their employees have the vaccination, as well as possibly cities and counties making sure that they have this mandated and getting more of their population vaccinated, especially in the counties that have very low vaccination rates.
Well, we've been talking more about breakthrough infections. COVID vaccines are meant to prevent severe illness. That means recipients can still contract the virus. But I wonder, Doctor, where the science is right now. Do we know, for instance, if a vaccinated individual were to develop a mild case, could they still end up developing long-term COVID symptoms? Is that something we even know yet from the data?
Yeah, absolutely. This is a great question because this may contribute to the hesitancy that we see with vaccination, is that you may have, again, another infection with COVID-19. Now, the tricky part about vaccines is that it doesn't necessarily prevent you from getting the disease again. That is actually a very rare and low case of someone getting COVID after having a vaccination. Most likely, if they do, they will have a very mild form of COVID-19 and nothing that would make them go into the hospital and get admitted. So that's where we really need to create more of a message of people understanding the importance of vaccination, but also what comes with vaccination is that there is the possibility of getting reinfected, which is a very low rate, mild infection. And what we're seeing more is that we're having more severe outcomes of a variant that is much more infectious, much more deadly among unvaccinated persons.
Well, a new study published in The Lancet estimates more than 113,000 children in the U.S. have lost a primary caregiver to the coronavirus, and 1.5 million kids worldwide have lost a parent, a custodial grandparent, or other relative who cared for them. What are your most pressing concerns after hearing these numbers?
That again, we don't have a vaccine for younger children. And even when we were talking about the vaccination among our younger population over the age of 13, 14, and 15, we're still not seeing the numbers of vaccinated children that we would like. Again, making sure that you get the full 2 doses. But again, now having children that have a caregiver that has been taken by this disease only makes this messaging so much more important because this is a horrible byproduct of the pandemic. And we as a global community have that responsibility that we have to support children and their families. And the best way for us to do that is, again, to impress the importance on a vaccine message and also making sure that we see, such as states as California, which are now reinstituting their mask mandate, that even if you are vaccinated, possibly wearing a mask, but also for those who are unvaccinated to get vaccines and continue to wear a mask to decrease that transmission. Because again, you can transmit without having symptoms. That can be an asymptomatic transference of the virus, and therefore you can still transmit to someone unknowingly, and that's going to increase our numbers as well.
Well, Doctor, South Africa is now one of the hardest hit countries due to the Delta variant. Hospital beds and oxygen are hard to come by, and only about 3% of the population is fully vaccinated. What went wrong in the nation's COVID response, and what does the path to recovery look like?
The path to recovery for South Africa, as we've seen now throughout many countries in the world, such as India, which took a severe hit back in May, is that we are going to see this variant, again, going to different nations and seeing such severe outcomes as we are in South Africa. Now, again, having the vaccine distributed, the vaccine message is also of utmost importance in wherever we're instituting the vaccine message. So again, we are looking at numbers of those getting not only the complete dose of the vaccine, we still have a large number of the population that may have only had a portion of the vaccine, as well as those who were unvaccinated. So it boils down to making sure that the population understands the significance of the vaccine. But again, having that hospital acuity and the ability for a hospital to take care of the healthcare and not the patients, but the people who are actually getting COVID-19. We know that certain countries are not able to withstand the amount of people who are getting COVID-19 and being able to take care of them in their ICUs or taking care of severe cases of COVID.
All right, Dr. Jessica Shepard, thank you very much.